Hi. Welcome, everyone. So I'm Carole Fahkry. I'm a head and neck surgeon, and I serve as Associate Dean of Clinical Affairs. So I'm going to be talking briefly about the Clinical Practice Association, called CPA, and Office of Johns Hopkins Physicians, OJHP. So what is the Clinical Practice Association? It is really the clinical practice in aggregate of the department. So that includes School of Medicine physicians, clinicians, and APPs. So I like to think of it as if we were all one big multi-specialty group, and that's really the goal of the CPA, is for us to manage ourselves as one multi-specialty group. We are all members of the CPA in practice and by the bylaws. And it's really anyone who's billing under the Johns Hopkins University 10. There are other clinical entities, which I'll tell you about shortly, that are outside of the School of Medicine. So the CPA really is the clinical practice representing all faculty and non-faculty clinicians within the school. Who leads the CPA? We are led by Rick Redette, who is the Physician-in-Chief and Vice Dean of Clinical Affairs and President of the CPA. And I think the official leader of the CPA is actually the Dean and CEO. So Rick Redette is the president of it and serves the Dean, who also leads the CPA. What is the Board of Governors of the CPA? It's basically representation for all of us by our directors. And so it's a self-governing board, and each of our department directors serve as our representatives. Office of Johns Hopkins Physicians is an umbrella organization that works with the CPA, and it oversees other clinical entities. So you will hear about other clinical practices under the umbrella of Johns Hopkins Community Physicians, Johns Hopkins Regional Physicians, and those are all under the umbrella of Office of Johns Hopkins Physicians, which works with the CPA. The OJHP oversees the ambulatory care of Johns Hopkins, and that's ambulatory care outside of the actual hospital entities, so unregulated space. And OJHP is responsible for expanding delivery of care beyond what it presently is today. OJHP also refines education and training and practice and delivery systems. And so I think one of the highlights of initiatives in the past year was rolling out the digital scribe tools that are available to all of us, and before that, Dragon and things like that. So practically, what do we do? Our goal is to foster strong performance of clinical practice, provide access to as many patients as possible, and delivery of the best care through our operational practices. And we believe that the clinical practice is really foundational and supportive of the educational and research missions for the school. Recent examples of things we've done is the ambulatory capacity initiative, so making sure we all have best practices in terms of our templates so that we can provide Hopkins level care to as many people as possible who are seeking our care. Developing clinical activity expectations so that we all throughout the school have similar notions and ideas of what it means to be full-time within in our departments. Lastly, this is a great website. There's always a new education that comes out. How to bill, how to optimize our in baskets, and so please use this website as a resource if you ever have any questions, because it gets updated, pretty regularly, and every so often how we bill does actually change. So keep yourself informed. So that's it.
Thank you so much.
Don't hesitate to reach out if you have any questions.